Hello, everyone. My name is Corey Washington, Director of Marketing here at ZPaper. Today, we are tackling the evolving and highly important topic of interoperability in healthcare. For this session, we'll discuss how healthcare IT organizations are impacted and ultimately why some upcoming changes in this space are so important. To help us better understand this topic, I'm joined by Jon Elwell. Jon is the CEO of Kno2. Kno2's mission is to solve interoperability for healthcare industry and truly transform the way patient information is exchanged. Not only am I impressed by the people, work, and future-focused vision of Kno2, I also value the joint commitment both of our organizations share in transforming healthcare through connected experiences. Jon, it's a pleasure having you here today. Thanks again for joining me.
Thank you. Looking forward to it.
All right. So the majority of healthcare industry uses electronic health record systems, yet the ability to send, receive, find, and even integrate patient information among EHRs remains a challenge even in 2022. So Jon, what obstacles do you feel are stopping providers from achieving interoperability?
I think, first of all, the topic of interoperability is often solved at the technology level, so the provider is almost a victim to the outcome, meaning they can't affect it until their technology partner addresses it. So that's one, they're not in total control. Two, when you think about healthcare, the industry is vast. The number of systems that you're actually speaking to that need to speak to one another, right? Simple definition of interoperability, allowing system-to-system communication. You're tackling a very, very large topic. When you think about the thousands of disparate systems that sit across not only healthcare, but in different care settings where what's important to me as a provider, if I'm a physical therapist versus a neurosurgeon, you can imagine that my system and the data I'm collecting, things that are important to me, are different. And thus, how do we normalize and start to understand what needs to be exchanged and then how that possibility exists? So that's why it's taken us so long to get here. It's an incredibly complex formula that's trying to be solved. That being said, there's a lot of work being done to get there. I think we've made serious strides. I think the High-Tech Act, meaningful use, almost $40 billion in funding. They're all setting us up for success. But the challenges are vast, and it's not an easy solution. So we still have some work to do, but we're getting there. But I put the challenge on the technology vendors. The providers should just have the outcome, right? We didn't work with the banks to figure out how the ATM worked. We just got the benefit of the ATM working, much the way we should think about a provider, right? They should just feel the benefit, but not get caught up in how we're fixing it.
Oh, most definitely. And so really, you raised some really good points. I mean, the providers really stand to benefit a lot from this, as well as the patients. And so with them being able to benefit from all of this, what are some advantages you see for both patients and providers in the field?
So I think you said something earlier in your opening statements when you talked about the confidence that this would bring to patients. I think we've all experienced showing up at a doctor's office and they ask us the exact same questions that I was asked 2 months ago, a year ago, or maybe even a week ago, or maybe even the day before. What do you mean, my meds, my allergies, what procedures did I have previously? Just my name and my address. I just did this. How do you not know? We all fill out those same forms, unfortunately, typically with pen and paper on a little clipboard. And that just starts the road of eroding confidence when they realize that not one party knows the other. And when you really think about healthcare and the interdependency in which multiple care settings, multiple providers are responsible for your holistic care, and now you're having individual conversations that don't appear to be synced. That's an obvious one, right? Back to your point about confidence. Then you get into another obvious one for a patient where they say, well, we need to do an MRI or we need to do this test. And they're like, well, I just did that MRI or I just did that test. And the doctor's answer is, well, I don't have that result and I need that result to give you proper guidance. So the sharing of information so that I'm properly prepared as a provider to know what's already been done, for me to garner that information in advance of your scheduled appointment or the episode of care is hugely valuable and starts to bring a lot of confidence to the patient. I think it also dovetails into the second part of your question, which is how do the providers benefit? Imagine what it takes, the amount of knowledge, right? These are highly skilled individuals that went through years of training to be able to do what I consider a blend of art and science. And the more informed you are, the better you can perform your task. And so how informed is a provider if we're still sharing information via fax, 92 DPI on a piece of paper, versus systems being able to present opportunities, any kind of medication conflict allergies I need to be concerned about as I'm issuing a potential immunization or drug. Just simple things like that. Forget the complex case. So you can imagine how systems help aid a provider in being able to see and identify opportunities for improvement, risk reduction, further process of care. All of that is aided by the system if the system has the proper information. Well, that's only the case if the systems are talking to one another. So both have huge benefits. And I think that links to my earlier statement where that should just be what the providers are receiving. They shouldn't be trying to figure out how that happens. They should just wake up. They've got a scheduled patient today. They're fully informed. They're not wasting time asking us questions I just answered before. And they're fully informed, and we're getting straight to the issue that I'm most concerned about, which is my health.
Yep. Most definitely. It's really about transforming the experience throughout the care continuum, really making sure that a person has control of their care and the provider is able to provide a better quality of care because they have more information. And there's less onus put on the patient to constantly grab and obtain this information across disconnected systems and providers and organizations. It's amazing how this can truly transform everybody's way of life and their quality of life. So kind of moving on to the operational side as well of, let's talk about accountable care organizations, also known as ACO. So avoiding duplicate services and reducing or preventing medical errors are a major part of an ACO's overall mission in providing this coordinated, high quality care to Medicare patients. How can interoperability contribute to this goal?
Yeah, I think that if you don't mind, I'll expand it. I think that ACOs, value-based care, sometimes referred to as risk contracts, this ever-evolving economics of healthcare. All right, we often forget that though providing healthcare to me is critically important, there's actually a business behind the scenes, and oftentimes a for-profit business. So this is really the economic quotient that sits behind how care is provided. Whether it be an ACO, whether it be a value-based care contract that I've now assumed risk on a certain population, whatever that may be, transparency, what you said earlier, is critically important. Meaning my care is provided by several different individuals, likely not in my network and likely not on my EHR system. So how do I assess and control and get in front of issues to control costs, get to better outcomes? If I don't have good visibility of what's happening when I travel 5 miles down the street to the next provider, something occurs. Some guidance is given, some prescription is aided, some test has been taken, and that is not available to the entire care team. So you can imagine just how important this topic of interoperability is when you start to take that type of responsibility economically. Whether it's, like I said, an ACO or value-based care contract, you're taking risks to say that I'm going to be efficient enough to make this a profitable transaction. But I can't do that if I don't have proper visibility. So it's really, really critical, not only to the patient and the provider, as we mentioned earlier, but just the economics that the system is now undertaking. And by the way, in a very wholesome way, meaning it's really intended to drop the cost of healthcare.
Mm-hmm.
We all know the cost of healthcare in the United States. We know the burden of the Medicare budget. We're all feeling that, anywhere from our pocketbooks to availability of care. So these organizations, an ACO or somebody taking a value-based care contract, has a natural benefit to the holistic system, but only to the extent that they can manage it. And that access to data is critically important. So interoperability plays a very important role in those topics.
Most definitely, and especially as we're thinking about like making this transition throughout this time, as we're pulling in all this data, one thing we have to also think about is data integrity, data accuracy. And so some of the hurdles, especially in referral management, include maintaining accurate provider directories and coordinating care between doctors' office. Without this interoperability, providers, they must manage document handling and touchpoint tasks associated with these processes manually, which is slow, inefficient, and definitely mistake prone. What are some other disadvantages of not having these operational processes in place? And what role does interoperability play in solving those challenges?
Yeah, no, let me first start by saying I think it's an interesting perspective because, as you mentioned earlier, we do a huge amount of work in this space. It's all we do as a company, and we happen to garner a lot of feedback from end user customers and their perspective. So the manual processes today, unfortunately in healthcare, is largely attributable to a fax machine. It could be cloud fax, it could be an electronic fax or a fax machine, but they both still exist in the space. Now, what's amazing about that is that because they've been doing it for so long, they feel that they have an efficient process, right? They don't often complain about the process because I've been doing it for 30 years. It's really the change when they start to experience an electronic form of exchange or true interoperability or systems speaking to one another without a human in the middle. That initial reaction is somewhat uncomfortable because you're changing a process that's been so well ingrained. And that's why I said that we need to focus on the outcomes to these providers, not the technology which solves it or the standard. The discussion about FHIR, CCDA, HL7, those are all important things for us to consider as technology vendors. I think the mistake is we've let that conversation go too close to the provider because we're asking them to change. And they're changing something that, may be burdensome. It absolutely is. It takes a lot of time, a lot of staff. It's not productive, meaning information needs to be read in order to be understood and versus interpreted by a system. But the truth is that they have really good processes in place because they had to, and they've done it for years. So the way that this is really going to create efficiency operationally is that we truly understand the right information at the right time in the right place so that we can replicate the benefit that they've created over these 30 years, 40 years, 50 years of an old and antiquated process. That's when they'll benefit. That process, the internal systems will improve, their processes will improve. The other thing we have to take into consideration is it doesn't happen overnight. And so now I have two processes. I have the process I know well, but inefficient, called the fax. And all of a sudden I've got a new workflow because the referral came in electronically. And now I've got to manage both. And in the early stages of interoperability and incentives through meaningful use, there was a very small percentage that was occurring electronically. Well, a big portion of it was still happening through a very traditional method. That becomes a burden. The fact that I'm managing two processes versus one, whatever the one process is, actually becomes more burdensome. And so the pressure on us, all of us collectively as technology vendors in the space, is to get this problem solved even faster, to reduce the fact that I'm now managing multiple processes. Because any one thing I can get good at. It's hard when you tell me there's 3, 4, 5 different ways to get the same information. So that's what we lose sleep about every night is how do we solve that problem? Because all of this information that's moving around needs to be actionable, not a distraction to a staff. Right? And unfortunately today that's the case. So the manual processes absolutely exist. They have to be removed. It's one of the last industries to still be this archaic. Yeah. And on a topic that's really, really important. So yes, you're correct in your assessment, while at the same time we have to realize the change management we're putting these organizations through and respect that they did at least have a process on the old process. And now everything's new. And we've got to do our best to try to mimic those things and bring together a bunch of data in a way that's meaningful instead of just a huge amount of data that I just get overloaded at and I'd rather just go read it fast.
Exactly.
We've got a lot of work to do to make this perfect for the provider, and we should take that responsibility.
Most definitely. And with that, the deadline for healthcare providers to reach interoperability is literally less than 2 years away per the CARES Act. While there are other deadlines throughout this year and beyond, in 2024, all EHRs will be required to provide single patient exports and full system exports at any time. How do you think organizations can find connected, secure, and scalable solutions to help prepare for this change hit by 2024?
Yeah, I think that there's two things. I think a couple of things are very tangible right? The information blocking rule is now clearly defined and in place, right? So just the motivation to understand the availability of the data and ensure it's available. I think the federal government's done a good job by putting a focus on something called information blocking. It's simple to understand. It's not necessarily simple to understand the risk to it. It's very complex. But at the end of the day, it's a simple statement. Don't block information. Make it available. And if not, technology vendors have a lot of risk because they're putting the burden on us to make sure that it is. And if not, we actually hold risk in that equation. The second point you made is a very aggressive stance that says by October of this year, all electronic health information needs to be accessible. Now, what's interesting about that is that not all electronic health information sits in the electronic health record, often referred to as an EHR. There's many systems that hold electronic health information. It could be a document management system. It could be a lab system. radiology system, it's not all sitting in the EHR. And depending upon my level of adoption of technology, that may be even more complex. But there's two really easy targets to look at, right? The availability of all electronic health information and the ruling of information blocking converging into a very clear statement that said we funded $40 billion to put electronic records in place across the United States, and we want the return.
Mm-hmm.
That was done for a reason. It wasn't just to chart electronically. It was to allow these systems to communicate, reduce costs, improve the patient experience, and ultimately the outcome. And you can see the aggressive nature that's being put in place to make sure that we get there. It's a tall task. Meaning, think about, if you're a health system, well-funded health system, with staffs that are sitting there capable of helping guide and execute these deadlines and these capabilities, and you're backed by very large electronic health record vendors that are well positioned to serve it, that's great. But what happens if you're a single doc practice or two PT office, and you're up against the same challenge where you're just doing your work every single day, and you don't have a staff to help you navigate the things that are coming down? And that's really where the technology vendors have to step in and take accountability for the requirement that's been put in place and unlock it. And it's why we're a single-threaded company. It's why Kno2 is so focused strictly on connectivity, right, enabling interoperability at scale, is because this shouldn't be the two-provider office trying to provide excellent therapy delivered to their patients while they're trying to figure out information blocking and how I get the entire electronic record available. So there is absolutely skin in the game now. There's a tremendous amount of focus, incentive, and de-incentive, meaning I call it carrot and stick, to make sure that this happens. Now we've got to execute, and a lot of that pressure falls on us. We've got to do this on behalf of our providers so the providers can do what's well. They didn't go to school to be a technologist.
Right.
They went to school to take care of us. And so I think our responsibility to them is as technologists to solve the problem so they can do their craft.
Right. It is a very tall task that we have, but we're up for it. And I really do think that the work we do is so meaningful. And we are thoroughly excited to help providers get to this point, especially with folks like Kno2, to ensure that we can help them create these truly connected, better engaged experience for patients and providers alike. So awesome. I think that's all the time we have for today. Jon, thanks so much for joining me today. This has been incredibly informative. For all of you who are listening in, you may learn more about Kno2's interoperability as a service platform solution by visiting www.kno2.com. Thanks, everyone, and thanks again, Jon.
Thank you, Corey.